everybody. My name is Catherine Rutland and I am Clinical Director at Denplan, part of Simply Health. I'd like to welcome you all back. For those of you who missed part one, you need to go back and listen to part one of this two-part interview with Dr Mahrukh Khwaja. We had an amazing first interview to kind of set the scene of what she does, what she's passionate about, feeds into a huge amount of what I am passionate about. And we're going to use this interview to really explore some of the words she mentioned that you might have heard vaguely, but not really sure what they fully are, and really get into some of those bigger issues. So welcome, Mahrukh, and how are you today? Are you good?
Yeah, really good. Thank you so much.
Great. So one of the things you were talking about last time, and I think we both agree that it's something that's really important to discuss a little bit further and explore a bit further, is compassion fatigue. So you mentioned that last time, and I think we vaguely talked about burnout and issues, and you've mentioned how important that is and some of the evidence behind that. But I think it's really important, isn't it, especially at this point in time, for people to really understand what it is so that they can almost identify it in themselves, but also for those around them.
Yes, definitely. I think it's a topic that is pretty important, significant right now, but even obviously before COVID as well. When we look at the research, we know the figures are really high. So in the UK, in a recent study in 2019, the figures were 7 to like 30% of UK general dental practitioners experienced burnout. So super high. Just to kind of break it down, because yeah, as you mentioned, a lot of us don't quite know what it is, and we might experience it and get to that crisis point, not having picked up those kind of warning signs and symptoms. So there's 3 components of burnout. So you have emotional exhaustion. So you're severely kind of emotionally drained, and this isn't something which you can fix by purely going on holiday. This is, a big kind of drain on your emotions. The second component of burnout is a lack of personal achievement. So you might go into work really feeling, what's the point? My patients don't value me. What I'm doing with my dentistry isn't really making a difference. So what's the point? And a third component of burnout is depersonalization. Yes, so this is really when we view our patients almost like objects, and it's a really big component around burnout, and we lose our prized asset of empathy. So we just can't really connect to our patients. And this is exactly why burnout is so troubling, because it's really impacting this important kind of asset that we have, this connection with our patients. So burnout actually impacts then our thoughts, how we feel, and then of course our actions. So massive kind of impacts. And in terms of our behavior, it might be that we withdraw or we take time off, or we might even go into work, but we're not able to function as normal. So really kind of big impact when it comes to our lives. Compassion fatigue actually is an extension of burnout. And it's considered more serious. We know that both burnout and compassion fatigue are occupational hazards when it comes to just being a dental care professional. We're more likely to experience this. So with compassion fatigue, we are literally absorbing our patient's pain. So as dental care professionals, we are treating patients who might be going through depression, divorce, they might have recently had an accident, a severe loss, moving house, all of these kind of tremendous highs, but also lows. And if a lot of us, of course, are very compassionate people, very empathetic, and we want to connect to our patients. And so it can be possible that we take on our patient suffering. another kind of feature of compassion fatigue. So you get all of the signs and symptoms that you would experience with burnout. So you get that kind of severe emotional exhaustion, you're very cynical about work.
Something I learned in the ethics part of my master's was around the fact that if you lose the empathy, that's almost your guard point for your professional care level. And actually you start to lose empathy because of what you're saying, burnout, compassion, fatigue. The danger of that is that you start to lose that point of realizing, am I working in the best interest of my patient? And that's a really dangerous, obviously, place from a professional viewpoint to be, I think. And so it's not just that thing that people think, oh, it's okay, I'm still physically supposedly doing my job, but actually, are you being empathic enough to actually decide those really important things, that is this in the best interest of the patient? And I think that's quite critical, isn't it? That people can then get themselves into further difficulty because something does go wrong and they've then got a complaint against them, GDC, and it becomes a snowball, doesn't it? You think, oh, it's just me, it's not damaging anybody, but actually that then makes everything else worse as well.
Yeah, for sure. I mean, it's such a key kind of part of our personality trait. This empathy is really key in connecting with our patients, and if we kind of lose that, as you said, that has tremendous impact on our actions and the choices we're giving to our patients, whether we're talking to our patients in the right way, how we actually treat them. So massive impact. Just in terms of the difference, about burnout and compassion fatigue. So with compassion fatigue, you get the same signs and symptoms as you would with burnout, but also the kind of key difference really is that you also might experience PTSD-like symptoms. So things like flashbacks, being kind of alert, very, very alert, all of these things that you would associate with PTSD. So it is something a lot more serious than burnout, and it's something that can kind of progress into compassion fatigue. So there is also a conversation around whether it's the right terminology using burnout or compassion fatigue. So I imagine in the future that will change, because the key thing to remember is that burnout is not caused by a flaw in you. Actually, it is an occupational hazard. So some researchers have suggested, things like moral injury might be a better terminology. I know Kristen Neff, who's the main researcher in compassion, she talks about perhaps calling it empathy fatigue, which you just mentioned about how empathy is more important. It is so important. So I think perhaps that's a better way of kind of thinking about it. But yeah, massively important, probably areas that we don't talk about enough when we're kind of talking about the specifics around poor mental health outcomes for us.
Yeah, and I think that one of the things that kind of can lead from, and you may correct me on this, but one of the things that you do see a lot, and going back to your points on our last interview around social media and imposter syndrome. I mean, imposter syndrome has always been there in dentistry way before social media. Those of us who've been qualified long enough, well before social media, that's quite an issue for many of us. I think I've said it on one of these before. I very often feel like I've got imposter syndrome of how have I got here, and somebody's going to find me out. And that's a common thing. And social media then has almost exacerbated that as well, hasn't it? But it's you can, for many of us, we can say, identify it, laugh about it, switch our social media off for a period of time, get our heads back in order. But actually, there's bigger issues behind that, aren't there, as well?
Yeah, for sure. I'm so glad that we've kind of brought this back to imposter syndrome, because it's such a common, negative thought. It's actually more common in women. but certainly, you know, lots of men experience it as well. And as you were saying, Catherine, it's this feeling of that you're a fraud, that despite you upskilling, you know, you might have numerous qualifications, and you have this thought that actually I'm going to be found out, I'm not really good enough to be in this position. The issue with this thought is it can really prevent you from progressing, because it creates a certain kind of fixed mindset that actually there's no point in me trying, there's no point in me, you know, potentially upskilling and learning new things to help my patients, because, you know, I can't change, I can't get better. And it can really keep you small. And I know it certainly did when I was in the beginning of my career. And I would say that actually the depression and burnout were really big defining moments for me, in kind of shifting that mindset more towards a growth mindset, and just realizing that actually we all have this beautiful capacity to change our brain and learn and grow. So coming back to imposter syndrome, yeah, massively common. It is a negative thought that really impacts us in terms of our actions, as well as our thoughts and feelings. And what's the antidote to it? Well, there's several kind of psychological interventions that we can do, or kind of tools that we can lean into. I think the key one that I want to really emphasize is self-compassion, and self-compassion training. So self-compassion is a massive buzzword currently, but kind of just to break it down, it means really offering yourself love and kindness when you're suffering and, you know, you're experiencing stress, and it's really tools and ways you talk to yourself, where you're talking to yourself like you would a best friend, and you're offering yourself comfort. That's massively important, because imposter syndrome is actually very much connected with perfectionism. And a lot of us, particularly in the world of dentistry, you know, and healthcare, of course, have these type A personality traits of perfectionism, which means that we are very, very productive. We have these amazing goals, and we certainly, you know, achieve them, but it does mean that we're more prone to things like burnout. We're definitely more prone to things like imposter syndrome, and that really makes a kind of a big difference to our lives. So with self-compassion, I think the biggest thing really with that is, how do you do that? Because, you know, you probably know you need to be nicer to yourselves. Perhaps you catch yourself talking to yourself in a negative way. You might have really harsh inner critic, and you just want to do something to really help. And I would say to explore Kristin Neff's work around self-compassion. This is something I break down in my teaching. She has she describes three key components when it comes to self-compassion. So she talks about mindfulness, and ultimately that means when you go through things like suffering, or you know, a terrible situation, a patient complaint, or just stress from a day, whatever it is, and you're you know, suffering in some way, it's kind of leaning into exactly what's happening, and labeling those emotions and thoughts, but without judgment, just letting it be, and making room as opposed to resisting it. And that's the kind of first component, rather than getting lost in the story, because often, you know, something happens and we judge ourselves for it. So it might be a patient says something, and it might be that, you know, patients come in, you've cemented a crown, they've come in and it's a little bit high, and your immediate reaction is, you know, like, that's a problem. I didn't actually prep this crown very well. They shouldn't be in pain. I should have sorted this out earlier. And that being self-critical in that moment isn't going to help you. It's not going to motivate you. It's just going to make you feel really crap about the situation. And it might even make you avoid doing more crown preps. Yeah, so all of these elements make a difference. So mindfulness is the first component. Then it's leaning into common humanity. So reminding yourself that, look, we all suffer, we all experience these negative thoughts. We're definitely not alone in our experience, and that can be really kind of soothing in itself. And then thirdly, it's offering words of self-kindness, and that might literally be I'm really, really sorry you're going through this. And I've got your back. I'm really, really sorry, but I'm here for you, and I'm going to help you get through this situation. And it might even be just offering yourself, warmth and like a soothing touch. So it might be, even in the moment I'm talking about with a patient, when you're experiencing these thoughts, you could kind of squeeze your hand, you could squeeze your arm, all of those things that we know how to do to a friend, do it to yourself. And you'll be so surprised how effective these practices can be. So I would say self-compassion is a big kind of tool. There are several other tools as well, but that's kind of a big one. Of course, mindfulness is another kind of aspect as well. Exposure as well, and CBT. So yeah, there's so much more to this conversation, but just to introduce self-compassion, we started that.
And I think self-compassion is really, really important, isn't it? In the sense of you can do it in the moment. I think sometimes there's a lot around well-being, which is obviously right and fantastic, around finding time for yourself, making sure you get out into nature if that's what you do. For me, it's always get into water and swim, and that will sort my head out. There's lots of that kind of stuff around, but sometimes, as you say, as a clinician, or even in my role in the middle of a meeting or whatever it is, that there is something that triggers you, and actually to have those tools that you can use literally there and then is really powerful. I think it's because otherwise you go into a spiral, don't you? You sit, and it becomes just a repeating negative cycle of, as you say, you go almost back in time through every stage of that treatment or the conversation or whatever it was, and just those techniques to stop you doing that. And like you say, just being nice to yourself. It's I love that analogy, and I love that analogy of talking to yourself as if it's one of your best friends talking to you. I think that's great, because that's the power, isn't it, always of, and it's something that we've obviously, so many of us have missed through this time, of those friendships and we know how powerful they are. So yeah, turn it around on yourself. It's great. Love that.
The thing I love about self-compassion particularly is that we know how to do this. We know how to talk to friends. So this isn't something new, really, that we have to learn. It's just about kind of practicing it in the moment, as you were saying. And you're right, with self-care practices, they're really great, but we need some strategies that we can use in the moment. So that's where, self-compassion really shines, along with, things like mindfulness, or even things like cognitive behavioral training. We can do these things in the moment. And as I was saying, if you don't like the word self-compassion, think of other words that resonate with you, because language is super powerful. And I know, kind of having this conversation with men, or just other kind of dental care professionals, there's certain words that really don't connect with them. I mean, for me, self-compassion, completely all about that I think of self-love. I love it, but for other people it might not resonate. So use words that kind of resonate with you, and it might be, the way I think of it is like creating, growth mindset. It might be that really kind of leans with you, and that connects with you. So use that word. So how do I shift into growth mindset? Well, I can shift into growth mindset by talking to myself better, and in a kinder way. That might work with you better.
Yeah, and I think I think there's so much of that, isn't there, that we've alluded to through this today, and in the previous interview, that around breaking the stigmas of doing these things, or talking about these things, or and actually, if you feel uncomfortable about it, nobody knows you're doing it. It's but you can still do it. It's that. But it is that importance of people really understanding the power of it. And as we said again before, we shouldn't have to be getting to crisis point to have to learn these techniques. We need to we'll be learning them and building them into our lives, so that, be it personal or professional, to make sure we don't get into those, we don't get to crisis point. That's ultimately what we're trying to avoid, isn't it? As you say, we're working in a very stressful environment, is create those ways, as personally and within your teams, that you can protect yourselves.
Yeah, I think it's really, really crucial that we do that. So yeah, it's really exciting to think that you can train your mind in this way, and you can kind of be very active in, physically changing the structure of our brain, because our brain is neuroplastic, and we didn't know that. 20 years ago we thought our brain was fixed. So it's really amazing kind of knowledge to know that actually we've got this power to adapt our brain through our habits, and we can kind of train it towards more positivity, because our brain does actually have a natural negativity bias. So we do lean into these negative emotions or negative triggers because of how our brain has evolved, to look for threats. Yeah, it's super powerful things that we can do in the moment. I'm really kind of excited to kind of bring kind of self-compassion practices a little bit more, and mindfulness as well, because these are things, as you were saying, we can literally do as a team. We can do it at an individual level, we can do outside of work as well, but they make a meaningful kind of difference, and we can do that with our patients. And I certainly do that. I'll have a couple of deep breaths as I'm lighting my curing my composite. I love kind of composite bonding, so that's just fun kind of time to do that. But even like moments like if I'm going to make tea, kind of really savoring that moment, and drinking that cup of tea and savoring every aspect of it and being mindful in that respect, or going for a mindful walk, and really kind of being aware of my surroundings and being present. And that's the beauty of mindfulness. It's training our muscles of being present and resilience. And that's massively important, because a lot of us feel so rushed and tired and exhausted. So slowing down and having those moments is really nourishing. So if we can do that more at work, I feel as though that would really kind of benefit us kind of long term. And it isn't just a stress reliever. So of course it has massive impact when it comes to minimizing our stresses, and helping us react differently to that stress. But beyond that, we are talking about increasing things like self-compassion, happiness, and positive emotions, optimism, thriving, all of these great kind of well-being markers. So yeah, it's not just about stress or reducing depression or anxiety. It's also about flourishing, and that's why I kind of love it. And you don't need anything expensive to do it. This is all about anchoring to the breath. You can do it any moment. If you're in a queue, you can do this. It's just amazing. And you can do this with your nurse. I mean, I love aromatherapy, so I'll get a few essential oil drops in my hands, and me and my nurse, like in the middle of a really busy day, will just take 3 deep breaths, and that's it. That's our mindful practice. And it's literally 30 seconds of deep breathing. It's just so joyful. Yeah, because you're connecting directly with that scent, that's bringing you back to the present. And that's a great place to be, because you're not worried about the past or ruminating about the past. You're not thinking about the future and worrying about that. You're actually in the moment.
Yeah.
How many of us are missing those small moments that actually bring color to our lives? So yeah, it's such a beautiful kind of practice. Yeah, it'd be great to kind of see more of that, in the workplace, and we can bring it to the workplace. So I talk about morning huddles as well, and how you could actually start your morning huddle with a 1-minute kind of mindful practice, or end your morning huddle with that. And that's a kind of great way of just increasing that presence as a team. You could even do this online. I've been to online workshops around mindfulness, and I've done my own as well, and it's great. It's worth trying.
It absolutely is. I mean, we've been doing quite a bit as a company. We've done a lot on well-being because we've all been working remotely for the last year. So we've been very, very conscious of making sure that everybody has support. So we've had, yes, a lot of well-being stuff, and it's really powerful. And as you say, it's positive. It's a really positive thing. You don't need to be in a dark place to embrace it. And actually, hopefully, embracing it will mean that you're less likely to get to that dark place. This has been such an amazing discussion. Thank you so much. I feel like we should finish now because we're on a really positive note, and we've really brought it together. I'm so grateful for your time for both interviews. It's been absolutely fantastic. Mahrukh has a fantastic website, mindninja.org. So really worth going to visit, and follow her on LinkedIn. It's great, loads of little tips and stuff. I love it. It makes me smile every time it comes up on my feed. Yeah, just been amazing. Thank you very, very much. Yeah, I'm sure we'll talk again in the future because there's just so much interesting, powerful stuff.
Yeah, thank you so much, Catherine. That was amazing.
Brilliant. Thank you very much. Bye bye, everybody.